our updates and be part of our conversation squad.
Thank you so much. Thank you so much for that very kind introduction. Good morning, everybody. Thank you for sparing your very precious Sunday morning to listen to what little you need to know about cancer. And let me confess when I start that I know very little about this subject. We all know very little about this subject. And let me try and share whatever little I think you should know about this disease. And I would be failing if I don't, speak a few words about Mr. Ajay Gandhi. When he said I should be addressing Manthan, I told him, Mr. Gandhi, when I look at the list of people who have spoken at Manthan, it looks to be a very illustrious list, which I don't think I'm anywhere close to. And he said, Doctor, why do you have to think like that? Why do you have to think that you don't deserve to be in Manthan? You deserve to be in Manthan and you should be there in Manthan. And that's how I'm here in Manthan today. And it's, it pains me that he is not here with us today, but I'm sure he's happy wherever he is. With that, let me get on to the basics. Now, how I have organized this talk is I've tried to look at all the questions that patients ask me when we sit and discuss about their illness. What caused this? What is this? What should we be doing? What's the outcome likely to be? What are the things that can impact the occurrence of this disease and the outcomes that you can achieve with therapy? So I've tried to address all of the costs associated with therapy. And I'll end with my own little thoughts about what I feel we should be going, in what direction should it be. So let's start by asking this question: what is cancer? Now, from a social sense, when you say cancer, you always associate it with something that you cannot treat, you cannot eradicate, and it's a malady that's here to stay. And that's why it's called the emperor of all maladies. So from a medical standpoint, cancer is when your tissues don't listen to the controls of your body. Okay. In a way, all diseases are like that. But what happens in cancer is that there is uncontrolled multiplication of your cells. It could be cells from your breast, it could be cells from your pancreas, it could be from your large intestine. Wherever it is, for some reason, it doesn't listen to the body's controls and it starts multiplying uncontrollably. Why do people die of cancer? Because it results in organ dysfunction. Now, remember that all your organs have got some reserve. For example, for somebody to die of liver cancer, you should have 80% of that liver that is dysfunctional, or your cancer should have spread to another part of the body and affected some vital function, which leads to death. And that's why people die of cancer. We still haven't found a cure for a significant proportion of our cancers, but I have to say that the outcomes have significantly improved in the past few decades, and more so in the past few years. And we will look at some data as far as that is concerned. Now, it's always good to start with some numbers. This is a summary of statistics for India published in 2020. Like with all data in this country, there is a lot of underreporting in the numbers that you're seeing here. But let's go with whatever is available officially. The number of new cancer cases is just over 13 lakh. But look at the sad state of affairs. More than half of all of them will die. And there are many reasons for that, starting from late diagnosis, lack of access to therapies, lack of affordability, lack of expertise, and so on and so forth. Okay, so more than 50%. So 8 out of the 13 lakh will die. But remember that the prevalence, which means the number of people with this disease at any point in time, is about 27 lakhs. So that's got a lot of connotations and implications in terms of how we should be geared up to take care of these people. Now, these are the 5 most common cancers in the country. The first on the left is male, the next one is female, and then both sexes put together. So remember that breast cancer is the most common cancer in this country. When you put males and females together, remember that males also can get breast cancer. And then that's followed by lip and oral cavity and cervical cancer. lung cancer, and colorectal cancer. So these are the 5 most common cancers in this country. When you put males and females together, the pie chart on the lower left of your screen is telling you what the most common cancers in male are, and the one on the right tells you what the most common in females are. The most common ones in male are lip and oral cavity. That's obviously associated with tobacco consumption in some form. And then comes lung, stomach, colorectum, and esophagus. And this is collectively called as the aerodigestive tract, the passage that air and food take, lip, lung, stomach, colorectal, esophagus, and so on. But it's very different in ladies. It starts from breast, and then there's ovarian cancer. There's again colorectal, lip, and oral cavity cancer. And of course, there is cervical cancer. So these are the most common cancers that we see in this country. It can vary a bit depending upon whether you're living in the Northeast or whether you're living in the South. And we'll at some point in time during the talk look at why these differences maybe, or we can discuss it later during the discussion time. Now, this is one of the most common questions that people would ask. What causes this disease? Now, remember that it's not easy to get cancer. Cancer is multifactorial. You have to have so many of those unfortunate things coming together to cause this disease in you. And some of those are listed on the left, smoking, obesity. Now, cancer is recognized as a lifestyle disease now, like, diabetes, hypertension, and so on. And I'll quickly show you what percentage can actually be prevented. And, that's also there in your slide here. Exposure to chemicals, radiation, hormones, autoimmune conditions that some of us suffer from, and of course, very importantly, inherited genetic mutations. Inherited genetic mutations constitute less than 10% of all cancers that we see today. Now, why am I specifically mentioning this? The moment somebody gets a diagnosis of cancer, the question that they ask is, doctor, nobody in my family ever had this. Why is it that I'm having? It's very uncommon for genetic causes. When I say genetic, I'm talking about hereditary. Ultimately, everything burns down to your genes. But here, when I say genetic mutations, I'm talking about mutations that you can pass on from one generation to the other. Now, I think more than the one on the left side of your screen, the one on the right of your screen is more important, because this is giving you a list of preventable causes, right? Smoking, obesity, alcohol, exposure to radiation, lack of physical activity, bad diet. All of these are things that are modifiable. So remember that so much in your hands that you can do in order to prevent yourself from getting any disease for that matter. If you go through this list, this is not a list that is unique to cancer. Smoking causes so many other problems, starting from, chronic obstructive pulmonary disease, vascular disease, and so on and so forth. Obesity, I don't have to tell you what all maladies can obesity cause. So remember that all these are not unique to cancer. And this is something that I'm going to tell you all through this talk again and again and again. There's nothing very unique to cancer that you should be doing differently. Whatever is good for healthy living is good for cancer also, and can help you stay healthy, prevent this difficult to treat disease. So nearly 50% of these cancers can actually be prevented because you're looking at a modifiable risk factor here. But the question, or should I say the greater question, is, if you don't have any risk factors, could you still get this disease? And the answer is yes, because when you see somebody in the clinic, or let's say you take a group of patients with a diagnosed cancer in this clinic, you will find that nearly 80% of them will not really have a risk factor that you can pick up or spot. So the question is, will I get it even if I don't have risk factors? The answer is yes. And this is the analogy that I give my patients. Driving on the right side of the road can still get you into an accident. But remember that driving like this gentleman on the wrong side or the right side of the road, right? Here, right means the right and wrong is the right. Left side is the right side of the road as far as we are concerned. So if you're still driving on the left, you can still get into trouble. But remember that if you're driving on the right side of the road, you can get into trouble. Your likelihood of getting into trouble is more likely. So if you have a risk factor, if you have one that I have listed on this slide, then your likelihood of getting into trouble is more. But remember that if you don't have any of these, you still have a likelihood, but that likelihood is significantly less compared to somebody who has one of these risk factors. And there are always a significant proportion of patients who smoke, but who still don't get cancer. So that's why I said you have to have all of these, it's like nature working against you in spite of all the wrong things that you have to do and you don't, for you to get into a disease like this. So that's a small summary of what happens or what is the cause of this disease. And this is how I feel when somebody asks me what caused my cancer. And as I said, in the majority, I will not be able to spot and say that this is why you got your cancer. And it is exemplified by this cartoon on the right side. And this is somebody from Mayo Clinic who said this a few years ago and was highly criticized for saying this. But I think there's some truth in what he's saying, because I go through this every day in the clinic. Math suggests that most cancer are caused by just bad luck, because I said that in the significant proportion, you will not be able to spot a risk factor and say, this is why you got your cancer. The next question that most people ask me was, how was this missed? Could I have done something different from a medical standpoint that this cancer could have been picked up in its early stages? And that's where screening comes. What's screening? Screening is the ability or picking up a cancer when it is still not symptomatic. Remember that if you're going to the doctor with a breast lump and asking for a mammogram, that is not screening. So getting routine mammograms every year after the age of 40 is screening, because you're not symptomatic for that cancer, but you're doing a test in order to pick up that cancer at an early stage. Now, why is it important to pick it up at an early stage? It's important because the likelihood of cure is extremely high if you pick it up at an early stage. Let's say for patients with stage 1 breast cancer, the cure rates that you can achieve today is more than 90%. Now, think back. If you had cancer, it was death sentence. And today I'm sitting here and saying that your likelihood of getting cured if you get picked up in stage 1 is more than 90%. That is better than tuberculosis. That is better than diabetes. That is better than hypertension and the many lifestyle diseases that we are talking about today. But the sad part is that not all cancers can be screened for. Now, the cancers that we routinely advise screening, at least in the population, is breast cancer, cervical cancer. I'm talking about cervix that forms the lower part of the uterus, prostate cancer in males, colorectal cancer, of course, in both sexes. Colorectum is the large intestine, and lung cancer in a very high risk population. When I talk about a very high risk population, these are people who've been smoking for many, many years and have got a high risk of getting this disease. Now, these are typically screenable cancers where you have standard tests that can pick up your cancer at a very early stage. For breast cancer, it's a mammogram. For cervical cancer, it is something that's called as a Pap smear. A Pap smear is nothing but getting some cells from the mouth of the uterus, which is the lower part of the uterus. It's an outpatient procedure. Getting a colonoscopy, which is nothing but an endoscopy to look at your large intestine, is a very important test that's done once every 10 years for colorectal cancer. Prostate cancer, a lot of controversy surrounding prostate cancer screening, but getting a prostate specific antigen, which is nothing but a blood test that's done for this disease, which can be done once every year beyond the age of 50, 60, and so on. and something called as a low dose CT scan that you do to detect lung cancer. So these are some of the screen detectable cancers that we can get examined for. Now, this is something that's all over the news, that's all over the internet now. What percentage of cancers are hereditary? We did talk about it. We said about 10% or less are likely to be hereditary. Now, these are tests that commercial companies are offering at home. That means you get a blood sample or you get a smear from your oral cavity and send it to the company. They will do a super genetic analysis. And what all can they tell you? They can tell you what your ancestry was, or rather is. They can tell you about your present health and your future health, your diet that you should be taking and not, how much physical activity should you be putting on, and all the kinds of diseases that you can prevent or you can likely be getting in the future. Should you be getting a test like this in order to get yourself immunized against any disease for that matter? I think the answer is yes and no. It's good to know a lot of things, but remember that there are a lot of pitfalls whenever you're going about interpreting a data like this and applying it for yourself. Now, it all starts with technology. Technology is so good today. Technology can decipher so many things. Technology can give you a lot of information. But the question is, how much of this information that you get from technology is actually relevant to you today, right? A lot of these tests and results can actually be inconclusive. It'll say there is a so-and-so abnormality in you, and you may or may not get this problem. I don't know what is the significance of this. In fact, there's something that's typically described as a variant of uncertain significance, and a significant proportion of test results can be a variant of uncertain significance. Second important thing, remember that if you have a genetic abnormality, that does not guarantee you of getting a particular disease. If you have a genetic abnormality, it puts you at a higher risk. It does not guarantee you of getting that disease. Third, even if you find something, there is no surety that you will be able to act on it. Let's say you've got a gene that is putting you at a higher risk of pancreatic cancer. There is no screening test that we know of for pancreatic cancer. How frequently should you get a test done? What is that test? How do you act based on the test results? If it's inconclusive, what? If it's conclusive, what? There is nothing that we know about a lot of the results that this kind of a test will throw up. So the most important thing is to get counseled before you get a test like this done, because all of us think it's as simple as 1 + 1 is equal to 2. Remember that in medicine, 1 + 1 is never equal to 2. 1 + 1 can be 1, or 1 + 1 can be 5. Okay? Because human beings are not machines, and it's not, 1 + 1 is equal to 2 all the time. So when you're getting something like this done, in case you decide to get done, what is my advice? I would say no. In case you decide to get something like this done, please be well informed about the implications of a positive or a negative test. And that goes without saying for any test that you're getting done now, even if it's a screening test. What happens if the tests are inconclusive? What happens if your test is positive? What happens if it's negative? If it's negative, does it guarantee you of not getting the disease? The answer is no. You can still get it. So it's important to get a very thorough pre-test counseling before you get anything like this done, because these are very sexy tests, as they call it, that's available all over the place and not very expensive, should I say. Is cancer curable? The answer is yes and no. It depends upon so many factors, starting from what is the cancer, what is the stage at which it is diagnosed, how accessible are the treatments for that cancer, and so on and so forth. Because there are some cancers which are curable even if it is diagnosed in an advanced stage. For example, cancer of the testis, lymphomas. These are diseases where if you have advanced disease, even then your chance of getting cured is quite high. And these are some classic examples, stars who were cured of their cancer and who are living examples of the fact that cancer is curable. So it all depends upon so many factors that we listed. It's not a yes or no answer for this. But if you ask me as an optimist that I am, I would say yes, but it comes with a lot of riders there. The other thing that today is available, every 3-4 kilometers, at least in Hyderabad, is what is referred to as a PET scanner. Everybody will ask you, doctor, should I get a PET scan done to pick up cancer? A PET scan is, the expansion of PET is a positron emission tomography. It's just an advanced imaging modality, something like a CT scan or an MRI. When patients get treated with us for cancer and then they're coming for their follow-up, the first thing they was, doctor, should we get a PET done to see whether the cancer is there or not? Remember that these modalities, when they're used in follow-up after treatment of cancer, remember that it's a very important and useful modality that needs to be done at the time of diagnosis in most cancers. In some cancers, it's not very useful. But what we find is that because of various reasons, starting from the physician side and also equally importantly from the patient side, there is a lot of overuse of these PET CT scans. Remember that these are scans which are so good, it's like our technology, right? It throws up a lot of things for which you may not have answers at this point in time. So that is why when it's not indicated, it's always better not to do. Please don't do a test for the sake of curiosity. Please do a test when you know how to act upon the results of that test. This is very, very important. And this is something that is taught to all of us in our early days in medicine, which most of us to a certain extent tend to forget for various reasons. But please remember that any test, and that includes just getting your hemoglobin done, is it relevant? Is it important? What are you going to do if the hemoglobin is low? What are you going to do if the hemoglobin is high? What's the implication? Can you treat it? Can you correct it? I think these are all questions that are very, very relevant, even more relevant from a patient standpoint before these things are done. The other important question, how to prevent or reduce the incidence, right? Remember, 42% on that pie chart that I showed you earlier, 42% can be prevented by modifying just your lifestyle, okay? Look at this gentleman on the left. That's the paradox. That's the irony. We are talking about pollution on one side and we go smoking away to glory on the other side. Remember that the most important correctable factor is tobacco. Tobacco, tobacco, and tobacco. If there's one thing I want you to take back from today's little about cancer talk, is that shun tobacco in every form, right? Because in India, most of the tobacco consumed is chewable tobacco, and it's not in the form of cigarettes or cigars. When I am talking about chewable tobacco, I'm talking about, keni, pan, and so on and so forth, which is what 65% of tobacco consumption in this country is all about. So we should not go home with the impression that it's only smoking that's going to cause lung cancer. It's only BD or cigar that is going to cause lung cancer. Remember that there are a lot of carcinogens, more than 100 carcinogens in tobacco smoke, which can get absorbed into your body and can cause cancers in areas as distant as the urinary bladder. Where is the urinary bladder and where is your mouth? You're putting tobacco into your mouth, chewing away to glory, and this carcinogen gets into your blood. It goes all over the place. It gets secreted into all the secretions in your body, and it can cause cancer in so many distant organs. So no to tobacco in any form. Please don't think a BD is safer or a cigarette is safer or a cigarette with a filter is safer. This causes less cancer. This has got lesser tobacco. No, there's absolutely nothing like that. Stop using tobacco in any form. Play, physical activity in plenty. Alcohol, in moderation or as little as possible, or stay away. Obesity is a very, very important cause of many cancers. It causes cancers of the large intestine, breast, uterus, gallbladder. There are nearly about 12 organs in the body wherein you can have a higher incidence of cancer when you are obese. Fruits and vegetables, right? These are the things that you should be eating in plenty. very difficult, but unfortunately, that's what it, when somebody asks me, what are the things I should eat, doctor? I just ask them, eat your, always tell them, I'm sorry, eat all the things that people say are good for health, green leafy vegetables. I always tell them about the signal, the traffic signal, the colors that you have to take or look for in your vegetable when you're choosing them, dark green and leafy vegetables, orange vegetables, and the red ones. That's why I've put up this, picture here, which tells you all the colors that you should be fond of and taking. One of the most important things that you need to be aware of is that certain cancers you can get vaccinated for. Hepatitis B, hepatitis C, these are cancers. These are viruses that cause liver cancer. Okay, so people who are vaccinated for hepatitis B, vaccine is widely available, it is cheap. You can, to a certain extent, protect yourself from liver cancer. Cervical cancer vaccine, again, there was a lot of controversy about it. Let's not get into that. You can vaccinate adolescent girls. In fact, in the West, it's even used for men because it prevents against anogenital warts. It also prevents, to a certain extent, against oropharyngeal cancer. So these are some of the things that you use, that you can do in order to bring down your own risk of cancer, and tell people, that this is what you should be doing, because this is what brings down the risk of cancer itself. Go and ask your grandmother. Don't ask me what you should be eating. And that's the appropriate diet for all of us. It contains everything that you need. It contains everything in the right quantity. Moderation is the key word here, and balanced diet should not be what I'm showing in this chart on the right side. What should you avoid? Avoid red meat as much as you can. Avoid processed foods as much as you can. Sugar sweetened beverages, Coca-Cola and stuff like that. Avoid alcohol, and a big no to tobacco. This can bring down your risk of getting cancer by easily around 30-40%. These are simple things that all of us can do, but we don't care to do. And that's why at least some of us get into trouble with this. Is alcohol consumption safe? No, the answer is again a no. People will say red wine is good for health. I think that's just some escapism. Red wine is good for the heart. If it can be good for the heart, it should be good for all the other parts of the body also. Unfortunately, it is not. Okay, there is a higher risk of cancers of the head and neck, esophagus, liver, breast in women, and so on and so forth with alcohol consumption. So once in a while, a social drinking is absolutely fine. As the picture on the right side shows you, are you a regular drinker or do you do it occasionally? The other guy says, I drink occasionally, but the occasion comes very regularly. That's the problem with alcohol. Many of us, I don't drink, but I include myself in the population. We don't know where to stop, and that's where the problem arises. The other issue is the accompaniments with alcohol itself, and that's also shown on this slide. It always goes with some high-calorie snacks. Nobody, or very rarely do I see people having cucumber or carrot with alcohol. It's always one of those that I'm showing here. And smoking is a big association with alcohol. And we said tobacco in any form increases your risk of many diseases, and that's not only cancer. What about herbal remedies and dietary supplements? Can they help treating cancer? The problem is that no herbal remedy or dietary supplement or alternative therapy has been scientifically proven. Now, I emphasize on this word, scientifically proven, to treat cancer. There are anecdotes. There are always patients who will come and say that I took this and I became better. And you have to agree, because they took it and they are actually better. So there is something in our alternative forms of medicine. The problem is that we have not looked at it in an organized fashion, in a scientific fashion, and for some reason, they are not making an attempt to do it. Till we don't make an attempt to do it, this controversy is will continue to be there always. And this is data from the West, that you've got a 5 times higher risk of dying with your cancer if you didn't take the conventional treatment, which may be surgery, radiotherapy, chemotherapy, blah, 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 whatever that might be, and you went for an alternative therapy, right? So there is data, this is retrospective data, but there is data to clearly show that if you don't take your standard treatment, then your likelihood of dying from your cancer is much higher. We'll spend the last 5-10 minutes on evolution of cancer therapies. What is it that is available today? Are we any better? Are we getting better? Will we be curing more patients in the future? Now, this is a big list that I'm showing you here. This is an exhaustive list, but it's not a complete list of the various treatments. It all started with surgery, Shushruta, India. All of us know about that. 3000 BC, that's when surgical treatments first started. And then came radiotherapy, and then came chemotherapy. Where are we moving towards? We're moving towards things that are called as targeted therapies. One of the problems with cancer medicine is that it can cause a lot of problems. It can cause a lot of side effects. Slowly, we are learning to personalize this based on the individual and the cancer that they have. And the latest kid on the block here is something called as immunotherapy. Everybody who walks into the clinic today wants to know what immunotherapy is. Is it appropriate for their stage and type of cancer? Immunotherapy has made a big impact, and we should give this therapy its due. But remember that all patients are not suitable for this treatment. What's immunotherapy? It is nothing but an injection. We don't infuse immune cells. What we do, that's a kind of therapy that's actually coming up. It's actually approved in some diseases already, but that's not typically what we refer to as immunotherapy in today's context in most of our hospitals. We give drugs that will help your body to recognize and fight your cancer better. One of the reasons we get cancer, we spoke about autoimmune diseases. There's also less immunity, which can put you at a higher risk of cancer. One of the reasons is that your cancer is more smart that it can evade your immunity, escape your immunity. So these drugs help to bring down these evading mechanisms. It will make sure that your immunity will find out where the cancer is, go and destroy that cancer. But it's expensive, and it's suitable only for a small set of patients as of today. And I see also that there is a lot of hype around some of these newer therapies, because these newer therapies come with the promise that they're going to cure you. Some patients, doctor, there are so many advances today. Can you not find out something to cure my cancer? Unfortunately, we don't have an answer to everybody's problems and everybody's cancers. And that's why I like this, glass or a mug of beer. This is a glass of beer rather than a mug of beer. You see that the analogy is the net salary versus your gross salary. Sometimes the promises that these therapies come up with are much more than what they can actually do. And for a physician like me, it is not only important that the drug works in a clinical trial, because that's how drugs come into the market. It's also important that it works on my patient, and that's what you call effectiveness. And even more important in the context of medical treatments today is cost effectiveness. For 1 rupee that you pay, is it likely to be beneficial? What is the cost effectiveness that this therapy brings with it? And it's very, very relevant when you're talking about offering this therapy to a community, right? So it's very important in public health planning and so on and so forth. So that's where cost effectiveness is. What do we think of the future? We think medicine is going to be personalized and extremely personalized. That means you'll put your biopsy tissue, or you may not even need a biopsy in the future. You may put your genetic landscape into a machine, and the computer is going to give you what should be done. And you take that and give it to the pharmacy and take whatever is necessary and appropriate for you. And this is what we think is going to happen. I don't know, it may happen in the future, but my concern is that it will also make medicine very impersonal. One of the problems that we are seeing in medical treatments today is that it is taking the physician away from the patient. And I think that's very, very bad for medicine in general. And COVID is a classic example of that. We've all learned to do teleconsultations. I'm not a great fan of teleconsultation, just as much as I am not a great fan of these online meetings itself. There's a lot that you can do when you see somebody, put your hand around them, pat them, smile at them, and then that, I think, works much more than all the medicines that we have. Are cancer medicines affordable, right? They are affordable. Is the cancer treatment getting cheaper? Earlier the cancer diagnosis, the lesser the treatments you need, and the more is the likelihood that you'll be cured, and lesser is the cost that you're going to, spend on when you're talking about treatment for these cancer. So the bottom line is, cost is something that can be very relative. What is costly for you may not be the same for me, and so on and so forth. But I have to say that over time, all these medicines have become cheaper than what they were. The same drug, which was 10 rupees 10 years ago, has become 1 rupee now. So if you want to access the more modern therapies, they are certainly expensive, and that can set you back as far as your purse is concerned. But I have to say that in my short experience of 20 years in this field, I have seen that medicines have gotten better and medicines have also gotten cheaper. So the future is certainly bright. You have to be optimistic. And this is not what we want our patients to get to, get from, from being above the poverty line to being pushed below the poverty line, right? There are a lot of illnesses where the expense can be so much that with one admission to the hospital, it can set you back by many, many years in terms of your cash and your wealth and your assets. So we don't want this to happen. And that's why a lot of money is being invested in drugs which are called as biosimilars and generic drugs, right? Now, there's a lot of innovation going on all around the world, because even countries which are, the most well-to-do or suffering from excess of resources and money, as I would call them as, even they over a period of time will not be able to afford the innovations that are happening in medicine, right? Because of various reasons. And we've all seen the classic case of COVID vaccines and so on and so forth. But we should be ready to embrace innovation. We should be able to, or we should be ready to, should I say, invest more in these drugs which are cheaper, which come with a lot of research though, and can increase access in terms of patient care and so on and so forth. So these are things that we have to embrace and make sure that we take and follow in our day-to-day practice of medicine. What about side effects of cancer medicine itself? Yes, cancer medicine side effects can be very difficult to treat sometimes. And so the risk-benefit window, right? When I call the risk-benefit window, I am talking about a very narrow or a small window there. You should choose the right drug at the right dose for the right patient at the right time. If you do not do that, then your cancer treatment can be worse than the disease itself. I think, as they rightly say, wisdom is not when to treat, but wisdom is when not to treat, right? So you should know where to stop treating, because a significant proportion of patients who come to us are still coming to us with advanced disease where treatment is not going to make any difference to their lives. Treatment can be worse than their disease itself. So these are situations where you should be graceful enough to say, you should be brave enough to say, look, I can't do anything for your disease. It is important that you are comforted and you're sent to just palliative and supportive care, which is good care in terms of the symptoms, and let somebody die with dignity rather than putting them through a lot of drugs, making their quality of life worse, and ultimately losing them to the disease, or more importantly, sometimes the treatment. That's something that should never happen at all. What about access, attitude, affordability? I like these 3 A's, and this applies to any walk of life, and more importantly, cancer medicine. India is a huge country, and there can be many sets of people, as I'm showing you on this slide. The one on the left, suffering from excess of money, as I call them, they can afford anything under the sun. They probably don't need you. They will go abroad, take their treatments, and so on and so forth. The one on the right extreme, these are people who are suffering from poverty. They do not know where their next meal is going to come from. You can't talk about cancer, the recent innovations and the high cost medicines that are available to treat these diseases today. You should be able to get down to their level and help them with whatever they can afford, whatever the government can give them, and so on and so forth. But I think the vast majority is one in the middle, the Indian middle class, who deserves everything but cannot access most of them, right? And that's why I think the attitude of the patient and the physician, the family and the physician, their ability to access medications and being able to provide affordable treatment to all of them, to give them their best chance of a cure, I think is very, very important in medicine in general and walk of life in general there. If you ask me, what is it that this country needs? I think it's primary prevention. That means making sure that you don't get any of those modifiable risk factors at all. Your clock starts ticking or your risks is there as soon as you're born. The best way not to get any disease is not to be born at all. Okay, the moment you're born with your genes. Your genes are already carrying what is destined to happen. It may or may not happen though, but I think it's very important to keep in mind those modifiable risk factors that we spoke about. So much is in your hands, so much that you can do. So primary prevention is what this country needs. This country cannot afford to be able to treat everybody well. Though a lot of treatment in this country happens in the private sector, though a significant proportion of expenditure comes from within the pocket, still our population cannot afford what is happening in terms of the cost of treatments itself. And COVID is again a classic example of that. All of us have seen it happen during our lifetimes. So make sure that you take all the steps possible from your side to be free of disease. And that matters, any disease. And as I said, there's nothing specific for cancer. What is good in general is good for cancer, and what is good for cancer is good in general. It's the same story of the vegetables and the fruits and the nuts and the exercise and don't become obese and so on and so forth. Think for yourself, is cancer any different? No, it is not different at all. Remember, ladies and gentlemen, there's only one life to live, and you have to live it fully and well. So there's nothing hard and fast. There's nothing very strict. Live your life. Do everything in moderation. And I think for me, my parting, remarks as a physician is that all of us as physicians, we have this responsibility to cure, to comfort, and to care for all our patients. And that's why I like this movie. Whether you're a Tamil speaking, Telugu speaking person or a Hindi speaking person, it doesn't matter. Jadoo ki jappi, as they say, and that's why I said I don't like this online story and online, things. When you see somebody, just like what Sanjay Dutt or Kamal Hassan or Chiranjeevi does in this movie, putting your hand around your patient, patting their back, smiling at them, and then reassuring them that they will become all right, I think is the cheapest medicine and the best medicine, I would say. And it doesn't take much from the doctor and the patient to be able to take that. And my last word for today, and this is something that I've learned over years as a cancer physician, and it's very, very important. You treat a disease, you win or you lose. You treat a person, a lot of treatments that we do today are very disease-centered. All of us should learn to be patient-centered. If you treat a person, I guarantee you, you will win no matter what the outcome is. And with that remark, thank you so much, Manthan, for giving me this opportunity, and I hand it over back to Mr. Vikram. Thanks so much.
You're muted. Sorry. Thank you, Dr. Senthil. Thank you for a very comprehensive talk. It seemed very simple, but actually in that simple presentation, you've packed in a lot. From the risk factors to what we should be doing, the cost of treatment, following treatment, what kind of treatment we should be looking at. I think this would be extremely informative. Let me start off with one question. You spoke about the tests. You warned us against doing these genetic tests or even these PET scans, but you suggested that what people should be looking at: men once in 10 years, colonoscopy, women mammography, smear, etc. There is also another thing that's going on about blood tests for cancer markers. Is that again, one of those scams, or is that an advancement that we should be looking at a little later?
Okay, so thanks for that question. So it all depends upon how much you're going to look for in your blood. Whether you're looking at a part of your gene, whether you're looking at the whole exome, which is all the genetic material that all of us have. So if you're looking at, so let me go a step back. So the question that all of us have to ask ourselves is that before we do a test, we should ask ourselves, what is our risk of getting this disease that we are trying to look for based on this particular test? If your likelihood of getting that disease is extremely low, then the yield of that test is going to be lower than that. So we would prefer not to do a test there at all. Let's say you want to screen for prostate cancer in a 20-year-old. The likelihood of prostate cancer in a 20-year-old is nearly zero, right? The risk of prostate cancer in an 80-year-old is quite high. So it makes sense to screen an 80-year-old for prostate cancer. The second important thing is that how long is this 80-year-old? Because you might have a cancer, but that cancer might live with you and die with you. It'll never manifest during your lifetime. And that's why some people call screening as making people sick in pursuit of health, right? What happens? You start getting a test done, and that may be at various levels. It may just be a blood test, it be a genetic test. We look for all our genetic things in this blood only. So we look for all of this. Unless we know how to act on these tests, it's better not to get these tests done, is my humble opinion. Now, there might be varying opinions depending upon how literate you're about your interpretation and ability to go through further testing as such. But I think at the end of the day, there's nothing wrong in getting a test done, whether it's a PET CT scan or your whole exome genome that is sequenced. The point is that please be well informed of the implications of a positive or a negative test. Remember that a positive test does not guarantee you of getting that disease. A negative test does not guarantee you of not getting that disease. Okay, so this is something that all of us should clearly understand. It'll tell you a risk, but it will not guarantee you either way. So that's the importance of counseling before any test that is done.
A couple of our viewers were asking this. A lot of cancer patients we've come across were under severe mental stress. So does stress have, is it a cause factor for cancer?
Tell me who doesn't have stress, right? All of us are stressed in our own ways. The degree to which we get stressed might vary, but I don't think there is a single individual who can say, I don't have any stress at all. So I don't think cancer increases, stress increases your likelihood of getting a cancer. But I think cancer puts you through a lot of stress in so many ways. It puts you through, physical, mental, financial, social, and, there's so many implications that a disease like this can come with. So there isn't any clear evidence that stress will result in a higher likelihood of cancer.
Another interesting question here is that the moral dilemmas that physician faces are so many. What is the toughest choice you as an oncologist, what are the difficult choices you have to make?
Oh, I think every decision that you make is difficult in its own way. So, when I see somebody with a cancer, he's got 2 daughters to be married off, he needs an expensive therapy. What do you choose between? Do you choose between his life that you can potentially prolong, not save, versus saving that money for the 2 daughters who have to be married? It's a very difficult decision, right? Telling somebody you should not be treated, right? The one of the other moral difficulties that we always have is people not being able to access therapies which can potentially cure them. As a physician, it's very important, and I feel that one should go to any extent to get the treatments that are necessary for your patients and whatever they deserve. There are so many instances every day that we come across that patients deserve a very important life-saving therapy, but for various reasons are not able to get that therapy. And that makes me feel very, very bad. These are some social issues that I cannot really go and correct. But I think I have to go all out to see that whatever my patients deserve, whatever is appropriate for them is available for them. Moral and ethical dilemmas, I think, come every day, every time that you're sitting across with the patient and making some decisions.
Senthil, there is a question from Sujata Rao that how many of the 8 lakh deaths, if that's the correct number, could have been avoided if they had come on time? And
I think that's a very difficult question to answer. So the problem is we don't have a robust population-based screening program in this country, not because it should not be there, it's because it's very difficult to cover a country as big as India. And a classic example we are seeing now is COVID vaccination itself. There are social factors, there are many other issues that will govern any screening program itself. So as far as I'm concerned, I think every cancer and every cancer death should be prevented if we can. But if you look at those 8 lakh people who died, and if they had taken care of them reasonably without getting into any of those lists that we put up in terms of, what can be prevented with your small modifications to your lifestyle. So I would say at least a third or half of them could have been prevented with various interventions, starting from primary prevention to screening to treatment and so on and so forth. So that's a rough, a ballpark figure that I'm throwing, but I may be right, wrong, I don't know.
Doctor, there is this interesting question here about, can we have a relapse of cancer after being cured by it?
Oh, yes. So it ultimately depends upon what stage of cancer you were detected. So the earlier your stage of detection, and if you are treated appropriately, the likelihood of relapse is less. And the classic example, as I started with, is breast cancer. So if somebody has a breast cancer stage 1 and is treated, the likelihood of a relapse is probably less than 5%. So even in stage 1, you can have a relapse. On the contrary, let's take somebody with stage 3 cancer. You got a 30-40% chance of relapsing even after adequate treatment for that stage. So the answer is yes. So you should keep watching out if that cancer is coming back and treat it appropriately if it comes back.
There's one question here, which is that most of the cancer drugs are tightly controlled by the nexus of the pharma companies, hospitals, doctors. So even if they want to, they are not able to access these drugs in the open market. This is, in one sense, increases the cost of cancer treatment. So how do we break this nexus? Is that a major hurdle?
Absolutely. We call it a nexus because we find it very difficult to break, isn't it? so I think it's a major hurdle to giving patients the treatments that they deserve. So the classic example is that moral difficulty that I face every day when I talk to a patient saying, look, this treatment is available only with this amount of money. It's expensive because it's a multinational company that is marketing that drug in this country. Because of our obligations secondary to signing the trade organizations treaties, we cannot market this drug as a biosimilar or a generic till the time that the patent for this drug expires. So in short, there is something that can help you get cured better, but it is not possible for you to take it because of the cost. So that's something that, I face this problem every day when I speak to my patients. How do you break it? I think we have to make sure that some modifications are made in these treaties that we sign, that if these drugs are likely to give you a significant cure, then we should be able to provide it even in a developing country where this innovation actually didn't come by, with at an affordable cost, so that ultimately mankind will benefit from that innovation. by keeping it at such a high cost, we are keeping away a very important innovation which can cure lives, save lives away from mankind, which I think is absolutely wrong. And the explanation for this from the drug companies is that innovation is so expensive, and that if everybody copies their innovation and is going to make these drugs in parts of the world where they cannot afford these drugs, then how will they be able to come about with more research and more innovations and better drugs? I think there is small truth in that, but a lot of that I think is, inflated figures and hype. So, I am with you as far as that is concerned. I wouldn't call it an excess. It's an unholy marriage that all of us have gotten to because of the treaties and policies of the government and what we have signed. And this is nothing new. It's been going on for decades now.
Doctor, there is, you spoke about preventive factors, etc. There's a question here: why do we see cancers among children? And if once they're detected, are there better chances of their survival? Or and also, what should we be looking for in children as opposed to adults?
Okay, so I think the second question is easier to answer. Do children have a better chance of survival? And the answer is yes. And that's why a lot of our resources go towards treating kids with cancer. At least in our hospital, we always make sure that a kid is not turned away because they can't afford therapy. Somehow beg, borrow, steal, and make sure that you're getting treatment for that child, because childhood cancers are treatable and curable in nearly 70-80% of all situations, except some tumors like brain tumors and a cancer called neuroblastoma, which occurs in an area around the kidney. Most of these children with cancers can be cured. Why does it happen? I think, as I started by saying, that's $1 million question. We clearly don't know. As I said, all these modifiable risk factors don't apply to children with cancer. A lot of cancer in children is genetic. Some of it is because of exposure to, things during pregnancy in the mother. And some of them are these hereditary syndromes, part of which these cancers happen. So we don't know a lot about the cause for cancers in children, but the important thing is that a majority of them are going to be cured, and all of our resources should go towards making sure that these children will get their treatments as appropriately, and we should give them the best chance of cure from their disease.
What do you say? You think that, let's say, in the next 50, 70 years, this would be a fully curable disease? What's your prediction?
I think it will be nearly, I don't think we can claim that any disease will be 100% curable at all. So I wouldn't say it will be fully curable, but our ability to understand, treat appropriately would have improved by leaps and bounds in the next 50 years. And the majority will be cured, I suppose.
Doctor, I just wanted to ask you, because it seems to me from your presentation that cancer, one of the key solutions to, or rather cures, is detection and screening. How will that happen in the next 50 years? Because unless you detect early, you will not be able to cure it, right? Just having medication or treatment or surgical techniques, will they help in 50 years? Will they be far better, or will screening be better in these 50 years?
I think we need to move in both directions. We should make sure that awareness in public is better. We should make sure that at least for cancers where there is standard screening, patients, rather not patients, healthy individuals should be going to get screened for these cancers. A lot of this is already incorporated in many of our master health checkups that most of these hospitals actually offer. So I think it's important to make sure that we get screened. It's also important to make sure that we do primary prevention, part of which is screening, and part of it is make sure that you don't have all these modifiable risk factors in you. We also have to move on the other direction, wherein our ability to cure. So for example, in my own short 20 years in practice, I have seen that the cure for patients with, let's say, a disease like breast cancer, which is, I'm using this example because that's the most common one. For, let's say, stage 3 cancer has moved from anywhere between 40 and 50% to nearly 70% today. So I think these innovations are happening. They're happening fast. But as rightly Mr. Vikram brought this up, access to therapies is where the problems is. So how do we increase access to therapy? It's a very big question. It's a public health question. It's a question of policy. So I think that's a bigger question that it is impossible for me as an individual to really answer. But the simple answer is we should move in both directions. We should make sure that we're picking up things early. We should also make sure that our ability to treat is better. And the reason why I'm saying this is if you're putting in a public health initiative to prevent a disease today, the initiative is likely to show a result in about 2.5 decades. So if I stop a particular, let's say we stop tobacco today in the community, the drop in tobacco-related cancers is going to take about 15-20 years, if not more than that, to manifest in the community. So we cannot say I've stopped tobacco today in the community, so let me sit tight and watch. That's not going to happen. So, and always some people will continue to use it. You can't make it prohibited. You can't make it, again, there was a question in the chat box that I saw, why is it that the government is not preventing it or banning it? Again, it's a nexus. So let's not go into that controversial issue here at this point in time. So these are things that are never going to stop. So on one hand, we need to make sure that we screen, prevent, and so on and so forth. On the other hand, there should be a lot of innovation and research that's going on to treating patients who have diagnosed cancer. So it should be both sides.
Are there any sections of people who do not get cancer or who get cancer at a lower percentage? Some people living in mountains, some Japanese, something like that. Are there any groups of, is there any work being done all over the world on some section of people not getting cancer at all?
Not that I know of, at least, who are not getting cancer at all. I don't think anybody is completely immune to not getting it at all. Not that I know of.
Senthil, sorry, yeah.
No, yeah, go ahead.
No, we have spent a lot of time on prevention and on therapy. About screening, you've spoken about. There's a question here both about a community and personal level. That do we have the infrastructure to do screening at the community level? And
no, we don't. That's the simple answer.
Yeah. So what should we be doing for?
I think we have to do everything possible as individuals. Right, take care of yourself. I think as simple as that. Don't neglect anything that's continual. Let's say it's a back pain. All of us tend to ignore a back pain. It can be just as simple as a sprain, and it can be a cancer both. So if it's not getting better with the general interventions that we do, we take rest, we take a painkiller, you do some fermentation, and so on and so forth. If it's not getting better with that, then please make sure you visit a doctor. Right. We kind of neglect most of our health related issues, and especially women. It's an appeal that I'm making to all women. You're extremely important to the society. Women always tend to neglect it more than men. They have a lot of other priorities, the family, children, and so on and so forth. There's that limited budget that the family can actually spend on health. So that lady is always worried that that money cannot be spent for the child, and so on and so forth. So it is my appeal to women that they're an extremely important part of the society. Please don't ignore a lump in the breast. Please don't ignore a postmenopausal bleeding, because these are all cancers. If you pick up early, the chance of a cure is extremely high. You spend some money, or you can get into a scheme that the government is already running, where all these treatments are today available. People can access it easily, and your chance of a cure is so high that you can get back to what you are doing, what you're doing best all the time, taking care of everybody else. So it's very important to make sure that we don't neglect ourselves, and that will go a long way in, to a certain extent, making sure that these cancers are picked up early.
So you mentioned something about alternate therapies. In India, yoga is big, and meditation and things like even fasting. So do these help to prevent cancers?
As part of general health and well-being, these are good. These can bring down the risk of getting any disease, though there isn't any specific data as far as whether yoga can prevent cancer is concerned. But let's say yoga comes with bringing down your oxidative stress, bringing down the likelihood of you being obese, bringing down, and yoga probably is also associated, with, lesser vices in life. I'm saying probably, not necessarily. Okay, so as as by itself and as part of its associations, I think it certainly has the potential to bring down the likelihood of many diseases and probably cancer also. So it's good to do all of these things. Fasting, I'm not a great fan of that. Okay, so since you brought up fasting also as part of that, no, there's no evidence that fasting actually brings down the incidence of cancer at all, but the rest of the lifestyle related issues, yes.
Are these infrastructure and facilities in India state of the art? Or I mean, are we there, or we are 5 years behind, 10 years behind the rest of the world? Where do you think we are?
Okay, in terms of therapies that are already available in the clinic, we are on par with anybody else in the West. In terms of research, we are definitely a little behind compared to what the West is. A lot of the likelihood of cure being improved and so is because these patients are being enrolled into a clinical trial that is likely, not necessarily, to give better outcomes compared to what was already existing. So you get access to better therapies if you are in an academic center or a research center. But if you say that I want to treat breast cancer today, and then I want to access all the best treatments that are available, it's certainly there in this country for somebody who can afford. Any medicine today can be imported within 4 weeks. So it is never a problem to get these things into the country and treat them. I can hardly think of 1 or 2 therapies which are not easily accessible to people in this country, but can be done if you were in the West.
The last question, Doctor, it is the last question posed by the audience as well. Can you suggest any areas where NGOs can help to serve in cancer treatment?
Oh yes, in so many ways they can help. I think very important is, improving awareness of the disease. That's I think the most important part of it. Getting access to therapies for diseases or cancers wherein we can cure, and the classic example is children with cancer. Organizing something like a patient support group wherein you have patients who've been cured of the disease, patients who've been recently diagnosed with the disease. Organizing something like that, what happens is, patients are talking to each other. There's a lot of disconnect between when a doctor talks to the patient. There's a lot of disconnect many times between what the patient thinks is relevant versus what the doctor thinks is relevant. The doctor is always focusing upon many issues that are important from a medical standpoint. But that's not the only thing that the patient needs to know. The patient also needs to know many other things, starting from the cost of therapy, how long will the patient need to stay in the hospital, what are the things that are available in and around the hospital for that 4 weeks or 6 weeks that's available, and so on and so forth. Patients also will talk to each other to say, okay, this is the kind of side effect that I had after treatment, and this is how practically I manage this side effect. The doctor who's treating has never had that side effect. And all that I'm saying is from what I have gone through in the books and what I've seen happening to patients. But when patients talk to patients, it makes a huge difference. It's much more practical. It gives patients more confidence. So organizing, that's like a self-help group. So it's like a patient group that these people can organize, which can help patients to a great extent.
Yeah.
Never miss our updates and be part of our conversation squad.